We're back on our show this Friday morning. Great to have Phillip Guin with us. He's an oncology RN at the Cabrini Cancer Center, and we're going to talk a bit about skin cancer, sun protection. The summer is here.
Yes, sir.
You need to be careful when you go out there.
Oh, that's for sure.
Perfect timing. Thank you so much for being with us this morning.
Thank you. It's a pleasure.
Just touch quickly on the Cabrini Cancer Center. Tell us about it a little bit.
Sure. Well, I myself have been there. I'm a chemotherapy nurse there at the Cancer Center. I've been there about 4 years. It is a comprehensive cancer center. It offers chemotherapy, radiation therapy. We even have an OT specialist that specializes in lymphedema, which is we're the only cancer center in the area that has that. So it is a comprehensive cancer care center, and we're very proud of the work that we do there.
And do you have protocols with MD Anderson?
We do, actually. We have a relationship with MD Anderson. We have a lot of patients that when they have an unusual type of cancer or something that's difficult to treat, we'll go to MD Anderson, and we have that professional relationship with them so that we can follow MD Anderson protocols at the Cancer Center to kind of treat them following those protocols.
That's a great value.
And
yes, definitely.
Melanoma, that is something I'm sure that you're familiar with on a personal level.
Right, yes. It's part of the reason that I do what I do. When I was very young, my dad was diagnosed with melanoma, stage 4, and was considered terminal. But he sought out some really good care, and by the grace of God, he's been in remission for about 26, 27 years.
Wow, that's great.
And some of my earliest childhood memories are of those doctors and nurses taking care of him, and that kind of inspired me to do what I do. I wanted to, in some small way, be able to kind of do that for someone else's dad one day.
Early detection, the key.
Oh, definitely. Melanoma, most skin cancers are very treatable with early intervention. Melanoma, for example, has about a 98% 5-year survival rate if it's detected early, but that decreases dramatically if it's detected in late stages.
Was that with like your father?
Yes, my father was late stage. He was stage 4, which actually has about a 17% 5-year survival rate, which is very, poor prognosis there. Yeah, it's definitely, a scary disease if it gets into advanced stages. But if we can catch it early, it's very treatable.
Okay.
What are some warning signs?
Well, warning signs, we tell people that if you really should check your skin once a month is what's recommended. We say there's the Melanoma Foundation has a campaign right now called the Get Naked campaign, but what it is, it's actually
please clarify.
Yes, let's. But the idea is to every month make sure that you are getting in front of a full-length mirror and checking your skin from head to toe. The earlier that we can find those suspicious moles, the quicker that we can intervene and hopefully have good outcomes.
When you say suspicious moles, I'm sure we're going to go into this in the next segment.
Yes,
but
ma'am.
what is a suspicious mole?
Well, there's actually several things that you can check, but you're really looking at moles that are atypical, things that are new or different. So you got to know that baseline. You got to know what your normal is. And so one of the big things is if you do those monthly exams and then also yearly professional exams by your physician, it'll help you know what that baseline is so that you'll know what's abnormal later on.
All right, Phillip, we'll be right back. We're going to take a quick break and talk about some of the things you can do to prevent skin cancer.
Yes, sir.
In just a second.
Perfect timing for being here. Thank you.
Thank you.
Stay with us.